Good evening. I'm Michelle Leifer. I am the director of the USDAN Institute for Animal Health Education at the Schwarzman Animal Medical Center. Along with my colleague Kimberly Young, I'd like to thank you for joining us for tonight's event, Behavior Solutions for Pet Owners with Dr. Vanessa Spano. This webinar is for informational and educational purposes only and is not intended to substitute for professional veterinary medical advice, diagnosis, or treatment. If you have questions or concerns about your pet's health, it is always best to consult your veterinarian. Tonight's event will be recorded and we'll send out a link tomorrow in case you miss anything or would like to share it with a friend. We will be taking questions via chat and we'll save some time at the end of the presentation to answer as many as possible. I'd like to take a moment to let everyone know about an upcoming event. On Wednesday, April 2nd at 6 p.m., we will host a webinar on bird flu featuring Dr. Ann Hohenhaus, Senior Veterinarian and AMC's Director of Pet Health Information. We will open registration for that event by the end of this week, and you can find out more information and register for that event on our website, amcny.org/events. And again, by the end of this week, that the registration will be open. We also hope to have the link in our newsletter that goes out tomorrow evening. And now it is my pleasure to introduce tonight's speaker. Dr. Vanessa Spano is New York City's only board-certified veterinary behaviorist and the first ever specialist in this field at AMC. As one of fewer than 100 board-certified veterinary behaviorists in North America, she's part of a select group of experts dedicated to improving animal behavior through science-based compassionate care. Dr. Spano earned her veterinary degree from the Atlantic Veterinary College in Canada and completed a rotating internship at the ASPCA, where she worked with animals involved in humane law enforcement cases. She then pursued a residency in veterinary behavior and became board certified by the American College of Veterinary Behaviorists. Her expertise includes anxiety, aggression, trauma recovery, and compulsive disorders, with special interests in shelter medicine, psychopharmacology, and the psychological effects of trauma and cruelty cases. Before joining AMC, she served as medical director of the ASPCA Adoption Center, working closely with rescue animals and pet owners facing complex behavior challenges. Now at AMC, Dr. Spano is expanding access to specialized behavioral care, helping pets and their families navigate behavior challenges with a thoughtful, evidence-based approach. We are thrilled to have her at AMC and grateful to her for joining us to lead tonight's event. Please join me in welcoming Dr. Vanessa Spano.
Hi, everyone. Thank you so much for joining. I'm really excited to see you all. I'm just sharing my screen. So today I wanted to talk about the 3 M's of a behavior treatment plan. You might see on the PowerPoint presentation that just like many of you, I also am a pet owner and not just a veterinarian. And this is one of my rescue puppies, Papilla, from the ASPCA. So, while no one behavior case is ever the same, I always say there's generally 3 main parts to the treatment plan to consider. One is environmental management. Two is modification, specifically behavior modification, which is very similar to therapy in people, where coping mechanisms are learned. And if indicated, the 3rd M is medication. To understand why, in my opinion, the first M, environmental management, is so critical, I think we must first understand what it is that determines a pet's unique behavior and particularly the neurobiology behind it. I'll try not to get too complicated here. So, an animal's behavior, just like a person, is determined by 2 key factors: nature and then nurture. Nature involves those behavioral traits that an animal has inherited from its parents, which are coded for through genes that are found in cells. So, for example, studies have found that compulsive disorder in dogs may be, at least in part, due to a variation or a mutation inherited in a gene called CDH2. As another example, two other diagnoses, owner-directed aggression and separation anxiety in dogs, also may be associated with mutations in two other different genes, IGF1 and HMGA2. However, just because a pet has inherited these genes doesn't necessarily mean that they're actually going to exhibit these behaviors like compulsive disorder or separation anxiety or owner-directed aggression. The other key factor that's involved in an animal's behavior, like I mentioned, is nurture or epigenetics. Epigenetics, by definition, is the effect that an animal's environment has on the expression of the genes that they've inherited from their parents, whether or not those genes will literally be activated or silenced. And the same goes for humans. Specifically, an organism's life experiences, trauma, nutrition, engagement in therapy or training, lifestyle, and exposure to toxins and pollutants can determine whether or not a gene that the pet inherited will actually be expressed or not. But how does this actually happen on a molecular level? So this is probably the most complicated of the slides. Our DNA contains genes, like you see on the screen, and the genes code for certain behavioral traits. There's strands of DNA that contain these genes, which are wrapped tightly together by a protein called histones. When the histones, like in the first picture, are closing up the DNA strands, the genes in that DNA are held so tightly together that they are not available to be read by the body. And so they are considered silenced, or as a result, the genes that the behavior codes for, or the behavior that those genes codes for, is not expressed. On the other hand, like in the second picture on the right-hand side, if something happens in the environment like a trigger, which triggers those histones to open up a DNA strand, the genes along that DNA strand are available to be read by the body. And so now those genes are activated and expressed, and we see the behavioral trait that is displayed from the genes. So let's talk about an example. Let's say that your dog has a bunch of genes that he inherited. Oops, sorry. Let's say that your dog has inherited genes which code for fearful behavior, and that the environment has triggers which trigger that fearful behavior. When your dog experiences this trigger, the histones surrounding the DNA with the genes that code for the fearful behavior open up, like on the right-hand side. And so now those fearful genes are expressed. And so we see a dog that displays fearful behavior. This mechanism, and thus your dog's fearful behavior, becomes stronger and stronger with repeated exposure to the trigger of unfamiliar people. On the other hand, let's say that you actively avoid a trigger like unfamiliar people in your dog's environment. Without the trigger of unfamiliar people, the histones surrounding those very genes coding for that fearful behavior stay closed up, like on the left-hand picture. And so those genes are unavailable and are silenced, meaning we don't see your dog exhibit the fearful behavior that's being coded for by those genes. So while we can't control nature and the genes that our pets have inherited, we can control to an extent nurture, or the environment that we elect to put our pets in, and the effects on the expression of those genes. Neurobiologically, the more we have a chance to rehearse a certain behavior, the more you'll just keep doing it. Let's take us humans as an example. Let's say that you've inherited an anxious personality from your parents. You can't control that you've inherited these genes coding for the anxious personality, but you have the ability to regulate whether or not those genes will be expressed through a major influencer on epigenetics, which is therapy. In an attempt to treat the inherited anxious personality, you have two options. In the first option, you may choose not to do anything about it and don't go to therapy. Therefore, the more you rehearse your anxious thought patterns when triggered, the more likely you will keep engaging in those obsessive thought patterns. In the second option, you instead decide to engage in cognitive behavioral therapy and practice challenging those obsessive thought patterns with healthier coping mechanisms like interrupting negative thoughts with more positive thoughts and deep breathing. The more you compete with those anxious thought patterns that you inherited from your family by rehearsing these healthier coping mechanisms, the more likely you will continue to cope in a healthier way. If there's only one lesson you remember from this webinar, I hope it's this. No one should ever knowingly force their pet into a situation that's making the pet uncomfortable in hopes that they will learn that it's just not so bad and everything will be okay, also known as exposure therapy. Not only is this poor welfare for the patient, but there's literally no learning going on. Fear and anxiety, especially when pathological, interferes with the gene transcription that is involved in learning. So, all that's happening is the pet rehearsing the very behaviors that we see as problematic, the instinctive and fearful and aggressive behaviors in an attempt to escape from the trigger. The best thing that a pet parent can do for their pet is to manipulate the part of the epigenetics that they can control through actively managing the environment, which triggers the pet like avoiding triggers. There is absolutely no financial cost to this part of the treatment plan. By doing this, you're preventing your pet from rehearsing problematic behaviors and preventing the genes coding for that behavior from being expressed. Here's the other critical lesson. Behavior is a function of the environment. We behave a certain way because we are reacting to something in the environment. It's thus much more effective to try to change the environment than it is to try to change the patient. When's the last time you tried to change something about a person? Weren't those effects basically futile? So, as you can tell, I am environmental management's biggest fan, and I could keep going on and on about this. It's important lifelong, but it's especially critical early on in life during two major periods of neurologic development. The first, as you'll see on the left-hand side, is the critical period of sensitization or socialization, and the second is called social maturity. Why are these two so major periods? The environment more than ever exerts its influence on the pet's genes at this time. In terms of when these periods occur, the critical period of sensitization is between about 3 to 14 weeks of age in dogs. And in cats, it's a little earlier and narrow, between 2 to 9 weeks of age. After that, there's in the juvenile period in cats and dogs, which lasts up to about 6 months of age. And finally, after that, as you'll see on the right-hand side, is social maturity, which is very similar to adolescence in humans. Social and sexual maturity in cats lasts up until 18 months of age. And in dogs, it depends on the breed, with smaller breeds typically lasting up until 6 months of age or sorry, 18 months of age, and larger breeds lasting until about 36 months of age. This is why a large majority of my patient population at the behavior service is between 1 to 3 years of age. It's not uncommon for me to have owners tell me that their dog suddenly started showing aggression towards people at 2 to 3 years of age. Meanwhile, they were fine when they were first adopted as a puppy. It's because of neurodevelopment and the effects that the environment has had on a patient's genes that they inherited up until that period. To help this make sense, let's talk about something equivalent in humans. It's well known that teenagers' emotions are ever evolving during adolescence. And we typically don't see the development of certain psychoses in people like schizophrenia or mood disorders such as bipolar disorder up until a person's late teens and early 20s when social maturity is finishing, just like cats and dogs. So, why are these two periods so critical in terms of manipulating a patient's environment? It's because of what's going on neurodevelopmentally during that time. To first understand this, let's briefly refresh ourselves on the intricate neural system within the brain that codes for behaviors, personality, and behavioral disorders. I created my own analogy to hopefully help this make better sense, equating the neural circuit to an electrical system. So, neural connections within the circuit communicate with each other to express genes and tell our brains whether or not those genes will be expressed or silenced, and subsequently, whether or not behaviors will be expressed or silenced. Within the neural circuit is the neuron, like you see on this right-hand side. It's got the circle and then the line. And that to me is like the wire. And then you have the electrical particles, which are really the chemical particles that are transported between the two neurons. And then you have the synapse, which is like the outlet, and it's the space that allows the neurons to communicate with each other. So just as wires transmit electricity in the form of particles, neurons transmit chemical messages to each other in the form of neurotransmitters across a synapse. These neurotransmitters communicate how we function and our moods. So, for example, you may have heard of the neurotransmitter serotonin. Serotonin is involved in modulating mood. If there's a dysregulation with the serotonin neurotransmission, a patient may have a more fearful or aggressive predisposition. Another example of a neurotransmitter is norepinephrine, also known as noradrenaline. And that is a neurotransmitter that is involved in modulating the fight or flight response. It regulates the physiological processes such as heart rate and blood pressure. So you might guess if there's a dysregulation within the norepinephrine or noradrenaline neurotransmission, a patient may be predisposed to an alarmed or panicked personality. The expression or silences of these messages that these neurotransmitters carry in between neurons, and subsequently the mood and personality the pet displays, is modified by epigenetics through the environment. There are three key components to the development of an organism's nervous system, or the neural circuit, which I just discussed: the creation of neurons, or neurogenesis, and the creation of synapses, or synaptogenesis. However, there's one other component called neural pruning, which occurs at an escalated rate um, during social maturity. So, neural pruning is the process where the brain actually removes weaker neural connections and strengthens stronger neural connections. These neural connections communicate to tell the pet's brain whether or not to express or silence a behavioral personality that's inherited. Now, here's the key: whether or not a neural connection is actually considered strong or weak is largely based off of whether or not the animal is actively rehearsing the behavior or activity that the neural connection codes for. And this is why managing the environment is so critical, especially during the critical period of sensitization and social maturity, so that we can take advantage of neural pruning and encourage our pets to rehearse the neural connections coding for the behaviors that we want them to rehearse, and to prevent them from rehearsing the neural connections coding for the behaviors that we see as a problem. Let's take a sad example, but it's an easy example. Let's say that you have a puppy who, during the critical period of sensitization between 3 to 14 weeks of age, is with a not very nice owner. Additionally, let's say this puppy unfortunately inherited from its parents a fearfully aggressive temperament. That's a double whammy. Because of the neural pruning during the critical period of sensitization, the neural connections coding for the genes expressing that fearfully aggressive temperament are maintained and made even stronger because the environment is encouraging the puppy to display and rehearse those behaviors. Now, let's say, fortunately, this puppy is relinquished to a shelter and you rescue him at 6 months during that other period of neurodevelopment, social maturity. Upon adopting him, you recognize that he is exhibiting barking and growling behavior towards unfamiliar people. You have two options. In the first option, you can engage in exposure therapy and force the puppy around unfamiliar people, hoping that he'll learn he doesn't need to exhibit this behavior. But remember, there's no learning occurring because fear and anxiety interfere with the gene transcription necessary for learning. Because of neural pruning during social maturity and the environment you're putting your pet in, you'll more than likely have an aggressive dog towards unfamiliar people into adulthood, because all the dog did was rehearse those very behaviors. And so those neural connections coding for the fearfully aggressive behavior were practiced, rehearsed, and are now made stronger. In the second option with this puppy, you instead decide to manipulate your puppy's environment by actively avoiding unfamiliar people when you can, such as on walks and having visitors to the home, while you simultaneously engage in training under the treatment of an approved trainer and veterinary behaviorist. By avoiding the very triggers causing your dog to bark and growl, the neural connections coding for that inherited fearfully aggressive temperament aren't being activated, and so they weaken and eventually may even be eliminated. Additionally, through training or behavior modification, your dog slowly learns to cope and maybe even form positive associations around these triggers in a more controlled environment, which we'll talk about that when we discuss the second M, behavior modification or training soon. With rehearsal instead of these behaviors, those neural connections coding for the healthier coping mechanisms are being practiced, rehearsed, and maintained, and they're strengthened during social maturity, resulting in a much less fearful and aggressive dog into adulthood. Another benefit of managing the environment so carefully, particularly for patients who exhibit aggressive behaviors, is decreasing the risk of liability. Aggression is often rooted in underlying emotions like fear, conflict, and frustration. I will always say that no pet is ever aggressive out of being malicious. However, it takes time to treat an underlying emotional disorder like fear in animals, just like it does in people. And at that, even with treatment, an aggressive patient can do injury or harm to another animal or person at any time. Nothing will ever take away the risk of an aggressive event from happening, which is why avoidance of triggers and exercising safety in the form of tools like a muzzle in this dog or behind a baby gate is so important. So now that I've finished my soapbox on why avoidance of triggers and environmental management is so crucial, let's discuss the next M, which is behavior modification. Training is basically the layman's term for behavior modification. So I often use those terms interchangeably. It's very unlikely that a veterinary behaviorist will recommend the third M or medication for a patient with a behavioral disorder without recommending training. While medications may address the abnormal neurotransmission that a pet may have inherited, causing an emotional disorder like fear or aggression, relying on medications alone is just a band aid. Medications will not teach the pet any coping mechanisms, but just like therapy, behavior modification will. Even with medications on board, if a patient is not taught which behaviors and coping mechanisms are more appropriate to display when triggered, the patient will just keep exhibiting the only behaviors it knows and rehearses. There are two main learning theories in behavioral psychology which involve teaching through association: classical conditioning and operant conditioning. Through associations, a patient is taught to display a more desirable behavior. So, first, let's talk about classical conditioning. Classical conditioning encourages the patient to display a desired behavior or a conditioned response after the equal sign when presented with a new trigger or a conditioned stimulus by associating that new trigger or conditioned stimulus with a stimulus which already elicits that desired behavior or the unconditioned stimulus. And I know that was a mouthful. So let's talk about an example that I'm sure a lot of you know: Pavlov's dog. The desired behavior or conditioned response in that situation was salivation. Pavlov wanted the dog to salivate when he rang a bell, which is the conditioned stimulus. However, when you ring a bell, it's not typical for anyone to salivate. So, how did he do this? He paired the conditioned stimulus with an unconditioned stimulus or a stimulus which already elicits that behavior, salivation, which is food. So, with repeated associations, now the bell elicited the desired behavior, the conditioned response, which is salivation. So, what does that have to do with dog training? What does classical conditioning look like? A common example is called desensitization and counter conditioning. So, let's take apart what those words mean. The first step is identifying a trigger. Let's take an example of a dog that is fearfully aggressive towards other dogs. So, that's what I have in the picture. Your dog is the poor little greyhoundy dog, and then the unfamiliar dog that they're reactive to is the dog that's in the illustration. And so we've identified a trigger, which is other dogs. The second step is identifying a fear hierarchy of that trigger, which is what the true definition of desensitization is. It's identifying what is the lowest level or intensity that the dog can be exposed to that trigger without going over threshold. So let's say this dog in this example can see another dog at 30 feet away, like on the right-hand side, and not have much of a reaction. But at 20 feet away on the left-hand side, the hair on the dog's back starts to go up. Your dog starts yawning, your dog's putting his ears back, early signs of fear and conflict. Then, as you move closer to 10 feet away, which isn't even on this slide, the dog's reaction becomes really obvious and intensifies and escalates to barking and growling. A good trainer will know that it is key to determine which intensity of observing the trigger the dog starts to go over thresholds, like on the left side here, because they want to ensure that their patient is always kept under threshold, which is what desensitization is all about. Remember from earlier, there is no learning occurring when a pet is over threshold due to fear, anxiety, and reactivity. Those emotions interfere with the gene transcription necessary for learning. So, if in training you're continuously exposing your dog to another dog when they're over threshold, they're not learning anything. If the dog is routinely exposed, uncontrolled to other dogs 10 to 20 feet away, he's just rehearsing the defensively aggressive behaviors in an attempt to increase distance. We want to make sure we expose him to other dogs in a controlled fashion, controlling that the patient stays under threshold so he's actually able to learn, like on the right-hand side. After identifying the fear hierarchy, we need to identify an established stimulus which elicits a desired behavior from the dog, such as, like on the right-hand side, high-value treats, which make the dog happy. By desensitizing the dog to other dogs under threshold, no more than 30 feet or no less than 30 feet away, and associating the dogs with treats, classical conditioning takes place in the form of counter conditioning. Counter conditioning is conditioning a counter emotion, which is a negative emotion, elicited by a trigger with a positive emotion from an unrelated but now associated established stimulus. With repeated associations of other dogs to a treat while the pet is maintained under threshold, the dog will soon start to associate dogs that are 30 feet away with a treat. The distance can be incrementally decreased in training, again ensuring that the dog always stays under threshold. The other type of associative learning is operant conditioning, which is different from classical conditioning. There are four different ways to carry out operant conditioning, and veterinary behaviorists like myself typically recommend using specifically positive reinforcement. Positive reinforcement increases the likelihood that a patient will display a desired behavior by giving a reinforcer, such as a treat, to the pet as a consequence of that pet exhibiting that desired behavior. So let's go back to obedience training as an example. When you're teaching your puppy, like my little puppy here, or a kitten even, to sit, anytime your pet demonstrates a sit, you reward your pet with a treat. As a consequence to performing the desired behavior of sit, you reinforce the likelihood that your pet will sit again in the future with a treat. Your pet will learn that anytime he sits, he'll get a treat. So he offers a sit more and more in hopes that he will keep getting a treat. In my more complex patients, as an example, let's say that the dog is reactive to fast motion on walks, which unfortunately happens a lot where we're located in New York City. Joggers, skateboarders, etc. Anytime the dog sees one of these triggers, he lunges on leash towards them. We don't need the dog to love these triggers. We simply just need the dog to safely coexist with them. So, what is a desired behavior that you could ask your dog to do instead of lunging anytime he sees this trigger? Let's say through Puppy 101, he already knows how to sit very well. Whenever you notice a jogger or a skateboarder on your walk, you ask your dog to sit, a preferred, calmer, and safer behavior. Again, this should be ideally when your dog is under threshold and in the right headspace to learn. Anytime you ask him to sit upon observing these triggers on walks, you reinforce that behavior with a treat. You are increasing the likelihood that your dog will choose to sit instead of lunge upon seeing a jogger or skateboard by reinforcing that behavior with a reward. So, how many times have you heard me say in the second M that in order for a patient to learn, the patient needs to be under threshold and not fearful or anxious? This is unfortunately so apparent where we live in New York City. It's very easy for dogs to go over threshold on walks, not only because the city is a very unnatural environment, but because of all the fear-inducing stimuli it contains, like foot traffic from people and other dogs, noise, movement, flashing lights, etc. So, what happens if you're attempting classical and operant conditioning with your dog's triggers, but anytime he sees a trigger, he's always over threshold? And so you feel like there's no chance that you could train with your dog. This is exactly where the first M, environmental management, and then the third M, the right medication, come into play. However, before we go into a very general discussion as to how medications may work, I want to take a minute to discuss another form of operant conditioning or punishment that I don't recommend and why I don't recommend it. Positive punishment is another form of operant conditioning. It's the complete opposite of positive reinforcement. Remember, positive reinforcement increases the likelihood or reinforces that a desired behavior will occur by presenting the pet with a reward, like a treat. Positive punishment, on the other hand, decreases the likelihood or punishes that an undesirable behavior, like growling or biting, will occur by presenting the pet with a punisher, like a shock, vibration, prong, leash correction, or yelling. How does a punisher decrease the likelihood that a pet will display a certain behavior in the future? Because the punishment is uncomfortable. The punishment elicits some sort of discomfort that the dog does not want to experience again. If it wasn't uncomfortable, it wouldn't work. So let's take another example of a dog that fearfully growls when unfamiliar people approach her. On a walk, you recognize that your dog growls when unfamiliar people approach near her. To stop this undesirable growling behavior, you introduce a shock via a collar anytime she growls. So here's the dog, she's growling anytime she sees people. You immediately pair that growling behavior with an uncomfortable stimulus, which is a shock. The shock is uncomfortable. In theory, your dog will learn that anytime she growls, it's associated with a shock. And because she does not want to be in discomfort or pain, she will avoid the shock and no longer growl. But positive punishment is a form of operant conditioning, and operant conditioning is a form of learning. Remember what I've mentioned many times so far. The gene transcription required for learning is interrupted whenever a pet is over threshold and exhibiting emotions like fear, anxiety, and discomfort. If this dog is growling out of fear, the growl serves as a threatening, distance increasing behavior towards the trigger. If the dog is fearful and the shock also elicits fear, discomfort, and anxiety, how can the dog actually learn anything? That is a huge contraindication and a big reason why I never recommend punishment based training. And note that balance training also involves punishment based training. The kicker is that positive reinforcement is balanced with positive punishment. So here are some other reasons why punishment is unethical, unacceptable, and unnecessary. While punishment aims to teach the animal what not to do, it does not teach the animal what to do instead. As I've mentioned earlier, all behavior serves a function, and punishment does not address this. Without learning alternative behaviors to fulfill the function, the animal does not know how to cope, leading to feelings of frustration and helplessness. As I've mentioned before, many problematic behaviors are rooted in fear and anxiety and frustration. Punishment only worsens frustration, fear, and anxiety. These bottled up emotions are at risk of eventually intensifying. It's not uncommon, unfortunately, for these animals to start to direct these intensified behaviors towards the teacher bottling up those emotions. helpful warning signs such as barking and growling are punished. So I've created something called the ladder of canine fear aggression on the left-hand side, and you'll see at the bottom of the ladder is very subtle signs that a dog is uncomfortable, like yawning, licking his lips, looking away, ears back. As time goes on and the trigger's still there, the dog is saying, okay, I need to do whatever I can to get my point across because these subtle body language signs aren't working. So now I'm going to tremble and tuck my tail. My hair is going to go up on my back. Okay, well, if that's not working, I'm going to be more obvious. I'm going to bark. If that's not enough, growl, lunge, and bite. But if we use a punisher to punish pets out of helpful warning signs like growling and lunging and barking, we're often left, unfortunately, with a patient that seems to bite without warning because their warning signs have been punished. And finally, punishment leads to a loss of control, which is especially inhumane in moments of fear and anxiety. This subsequently leads to a worsening of fear and learned helplessness, as well as a loss of motivation. The animal's ability to learn other behaviors in the future generally declines. So now that I've thoroughly discussed examples of associative learning through behavior modification, let's discuss briefly the third M, which is medication. Like I mentioned earlier, what happens if you're attempting classical and operant conditioning and training with your pet's triggers, but anytime your pet sees the triggers, he's always over threshold and unable to learn? That's where environmental management and medication should be considered. The same medications that are used in people for the treatment of depression and anxiety are also used in animals with behavioral disorders because we all share the same brain and neurochemistry. A variety of behavioral medications exist because they all work on a different spectrum of neurotransmitters, which may be genetically imbalanced in any given patient. Some of these neurotransmitters, as you'll see here, are names that you've probably heard of: serotonin, norepinephrine, dopamine, GABA, glutamate, and a whole bunch others. A patient with a behavioral disorder may have a dysregulation in one or more of these neurotransmitter systems that they've inherited. Just to take an example in the literature, the spinal fluid of aggressive dogs was compared to that of control dogs or dogs that were not aggressive. In that study, dogs with aggression had significantly lower levels of serotonin in their spinal fluid. You may have heard of an antidepressant called Prozac. The generic of Prozac is fluoxetine. Fluoxetine works by increasing serotonin. Fluoxetine, like many antidepressants, doesn't just have an antidepressant effect. It has other mood regulating effects, which we would use in our pets, like anti-aggressive effects and anti-anxiety effects. It's probably not surprising then that many of my patients with aggressive behaviors experience a decrease in the intensity of their clinical signs when placed on this medication, which increases their serotonin. However, there are just as many patients with aggressive behaviors that don't improve with this medication, and I'll explain why. As another medication example, many but not all of my patients with fearful and fearfully aggressive behaviors exhibit these behaviors with physical signs of agitation and anxiety of the fight or flight response: dilated pupils, elevated heart rate, panting, probably high blood pressure. And when I prescribe a short acting medication called clonidine, a lot of their signs improve. Clonidine is a medication that decreases release of norepinephrine or noradrenaline. Norepinephrine is involved in the sympathetic fight or flight response when an animal is frightened. By decreasing the release of norepinephrine, the intensity of their fight or flight response lessens. I mentioned twice just now that you can't assume that the same medication will work for all patients, even if they have the same diagnosis. It may seem frustrating, but there is some scientific trial and error involved, just like people undergoing psychiatric treatment. It's not uncommon for a person to experience immediate improvement in their clinical signs upon first trialing an antidepressant. It usually takes some sort of dose or medication adjustment over time to find the right protocol, and the same goes for our pets. Ideally, We'd want to be able to test in a patient which neurotransmitter systems that they've inherited are dysregulated and subsequently choose the best medication which affects those neurotransmitter systems. I always tell my clients I wish it was like a UTI where we take the urine culture and send it to the lab and see what antibiotics become susceptible to it. That testing doesn't even exist in humans for these antidepressants. So, how do I determine what's the best medication for the patient? I have to take a very holistic and comprehensive overview. I look at their clinical signs, I look at what's worked for similar patients in the past, and I also look at in the literature what's worked, and I determine from there. It's also important to know the patient's general health status through a review of their medical history and physical exam and comprehensive blood work, as none of these medications, while generally very safe, come without side effects. And in fact, certain patients shouldn't receive certain medications. For example, I mentioned clonidine, which decreases norepinephrine or noradrenaline in the previous slide. I generally don't recommend patients with heart issues or blood pressure issues take that medication. There are other medications which patients shouldn't take if they have a history of liver disease, for example. The details of psychopharmacology, which I'm discussing here, are not generally taught in veterinary school, but instead they require a residency post graduation, which I needed to complete and pass a board exam, just like a cardiologist or a neurologist. So, we've gone over the three M's to the behavior treatment plan: management, modification, and medication. But what else is there to know about treating behavioral disorders? While there are ways to manage these disorders and decrease the intensity and frequency of clinical signs, unfortunately, there's no way to actually cure or eliminate a behavior disorder. I emphasize this for two reasons. First, there is no timeline to completing treatment. Learning is lifelong. I've never met a person who required only 1 month's worth of an antidepressant or only 1 month's worth of talk therapy and their anxiety or depression was cured. The same goes for our pets. Far too often do I see a patient that has consistently improved over the course of a few months to a few years, only to eventually experience a regression. And this can feel really defeating. More often than not, it's because pet parents understandably may start to ease up on previous environmental management because the pet's doing so well. But these practices really should be exercised ideally lifelong, as learning is lifelong. Finding the right medication doesn't mean that your pet has it made for the rest of their life. And the second reason why I emphasize that behavioral disorders cannot be cured is specifically for pets with aggressive behaviors, like I mentioned earlier in the lecture. Whether aggressive or not, no behavioral disorder can be cured, which means even with treatment, and even upon observing your pet's aggressive behaviors diminish with treatment, nothing will ever take away the risk of an aggressive event from happening. There will always be that risk, which is why avoidance of triggers and, when unavoidable, the use of safety tools like a well fitted muzzle and securely locked barriers separating your pet from the trigger is critical. And finally, how do we measure improvement with this comprehensive treatment plan? I recommend analyzing four different criteria. Number one, the intensity of the behavior. If your pet typically growls, lunges, attempts to bite at a trigger, now can we get them down that ladder of aggression on the previous slide? And instead of growling and biting, they're barking and they're tucking their tail. So it's not eliminated, but it's a lot less intense. Number two is a decrease in the frequency of the behavior. If your cat soils outside of the litter box, and we've ruled out that it's not a medical issue and we have them on treatment, is it happening all the time and now only half the time and now only a quarter of the time? A third is recovery time. So, for example, with separation anxiety, you leave your home and your dog barks for an hour straight, but now are they only barking for 10 minutes or 15 minutes? And then finally, your pet's ability to disengage from the trigger to apply coping mechanisms that they learned in training to actual real life situations. So I just put a few of my references on there. These are two of my kitties. Um, Thank you for joining me.
Thank you. Thank you so much. That was fantastic. A really great overview of everything. We do have a number of cat owners on who are just wanting to know how much of this applies to cats. Basically the associative learning through behavior modification, how much of that is cats as well. I know we can't go through everything, but yeah, a lot of it does, right? But
Yeah,
just, yeah,
it's a good question. It applies to every mammal and avian and reptile. They all learn the same. We all have a similar brain. So it's
great.
all exactly the same.
Okay, great. Okay, and also we just wanted to go through, many people confuse trainers, board certified veterinary behaviorists, general veterinarians, certified veterinary consultants. Just can you explain what's the key
Yeah.
differences in how they work together as well?
Absolutely. So, a veterinary behaviorist, a veteran is a veterinarian. So they needed to go to veterinary school to get their DVM degree, and then they decided to move on to a residency specializing in behavior. There are lots of really good trainers out there, and there's a lot of different names for them: trainers, behavior consultants, and trainers typically should work hand in hand with the veterinary behaviorist. They basically share a treatment plan in a way, and I always explain it to my clients. It's almost like physical therapy where I'm like the doctor. Well, actually, in terms of mental health, I'm like the psychiatrist that prescribes medications, prescribes cognitive behavioral therapy, and then I refer them out to a trainer who's like a talk therapist to teach the coping mechanisms. I'll do some of the training myself as well, but more often than not, pets do require a decent amount of training for at least a few months, which can be outsourced with a trainer. And then, some good like certifications to look out for in terms of training. So CPDT, which is Certified Professional Dog Trainer, KA, KPA, which stands for Karen Pryor Academy, IAABC or CAAB, which is a Certified Applied Animal Behaviorist. It's a lot of initials, but those are really good ones to look out for.
And we can share those links and that information tomorrow in the email we send out. Okay, we have a question. My cat gets so very, very upset when she sees her carrier when we go on a trip. She's inconsolable. The vet has given her medications. Nothing works as she throws up anything we give her. Other than not bringing her with us, what can we do? I adopted her at 3 months when she was severely injured. Her leg needed to be removed. She's now almost 3 years old.
So I'm sorry to hear about all that troubles. I think it depends. Cats can a lot of times not like a change to their routine and their environment. They really like their house. And certainly, if you have a trusted cat sitter that can stay with the kitty, that might be relatively more beneficial. Other times, with regards to traveling, certainly I found that there's a lot of overlap between motion sickness and fear and anxiety. Oftentimes we see pets that vomit in the car or on the train, and it could have started as motion sickness, but now they associate the car, the train, etc., with being sick. And so now they're also nauseous on top of being sick. So I would definitely consider asking your vet about motion sickness. And there's lots of ways to try to carrier train cats. Certainly, if you keep using the same carrier, cats are very smart, and so that carrier is already tainted, so to say. So my recommendation would be to get a brand new carrier, just leave it out all the time, and let your cat explore it, toss treats into it. Don't force your cat to go into it. Let your cat choose to go to the carrier themselves, because choice is agency. And then over time, anytime you catch them going into the carrier, you reinforce them. So you just gradually work up towards it.
Okay, great. Okay, another cat question. My cat was on my screened-in porch when an outdoor cat that's not mine walked up to her. That cat did nothing. My cat started hissing, hair raised, and tried to run after the stray, but ran into the screen. Um, when my cat came inside and saw my other cat, she attacked her twice. Now I cannot have them in the same room. They've been living together for 5 or 6 years. How do I restore harmony? And they said this just happened last night.
Oh
So, yeah.
man, I'm sorry. I have a multi-cat household as well, and I've had to take my cats recently back and forth to the vet, and one of them gets so stressed when the other one comes home, despite that they're really good friends. So I understand the delicacies of cat harmony. Um, it could have been that this was a redirected event, unfortunately. Your other cat was in the wrong place at the wrong time. Um, I would say definitely keep them separated for now, just to allow time to decompress. And you could feed them and give them treats on other side of the doors to make positive associations and gradually do a slow introduction. But I think more than anything, they just need time.
Okay, great. Let's see. I adopted my dog from a rescue when he was 2. He was a biter, but loved me immediately. He was abused, has a seizure disorder. He's so good to me, but has to be muzzled for the vet. He hates the muzzle. How can I train him to accept the muzzle?
Yeah, I have a whole protocol on muzzle training. It's like what I said earlier, classical conditioning. So remember, it's desensitizing and counter conditioning. So get a brand new muzzle that looks different, that smells different. And we need to identify the threshold with which your dog is exposed to the muzzle but has no reaction so that they can learn. So I usually recommend taking the muzzle and just when they're running around outside or you're taking them for a walk, just every once in a while show them the muzzle. Don't put it in their face, but just show them the muzzle for a few seconds, associate it with treats. Do that for a while. Once your dog sees the muzzle and realizes, oh, this is associated with treats, ideally they should start looking at the muzzle more in hopes that they'll get treats. Then, if you get one of those basket muzzles, which is was in one of my photos earlier in the slide, it has holes in them. You could try to stick treats through it, like string cheese or a little stick with peanut butter on it or something. And you could stick it through without putting the muzzle on your dog's face, stick the treat through the hole and allow your dog to stick their nose through the muzzle to try to get the treat. Don't expect that immediately your dog's gonna wanna keep their face in the muzzle
Mm.
for a minute or 2 minutes or 3 minutes. Just expect that they're gonna be there for 5 seconds and then stop. And you gradually work desensitizing them to keeping their nose in the muzzle. Then eventually, once their nose is in the muzzle for a minute, then you could work on clipping it. So it goes really slow because we have to desensitize them, which means we have to expose them at a level where they're not going to be afraid and make sure it's always associated with the treat. It is very slow, but it's very worth it because your pet's going to need medical handling for the rest of their life. And I always tell my clients, unfortunately, with training, if you think you're going too slow, go even slower, but it's worth it. And if your dog is fearful at the vet, I would ask the vet about some meds that might help.
Okay, great. And I guess, and just in terms of the muzzle, I know some owners are reluctant to use it or hesitant because they worry that it makes their dog look aggressive. But I think, as you were saying, can be a very useful tool, right?
Yeah, and I fully admit that it is not changing the underlying emotion to the trigger that your dog is reacting towards. But while you're working on that, it keeps everyone safe.
Great. I adopted my dog when she was 3 years old. Is there any hope for her to get better having passed the critical socialization period? She's fearful, nervous, excuse me, but defensive.
Yeah,
Um,
absolutely. Good for you for rescuing. I'm all about adopt, don't shop, especially for these poor pets that had just not had great experiences unfairly early on in life. And learning is lifelong. Even though they've passed that period of social maturity, it's not like there's no nerve connections that are ever being made, and it's not like there's no nerve connections that can be eliminated. You should still manage the environment, like I said in the earlier parts of the lecture, and consider working with a trainer and your veterinarian. It's going to take a while, but there's still hope.
okay, great. Um, what are the possible reasons why my dog will be reactive to some, but not all dogs we encounter on our walks?
What are the possible reasons you said?
Why they might be reactive to some dogs, but not others on their walks?
Yeah, so that it could be a bunch of different things. So, um It could be they are more reactive in a certain area versus not, and they don't just have to deem their house or their or yard territorial. They could deem their neighborhood territorial, and once you take them out of their neighborhood, they don't react that way. So it could be a territorial thing. It could be a protective thing if they only act this way when certain people walk them, so they feel the need to protect mom but not dad, or vice versa. But if it's neither territorial nor protective, it certainly could be social anxiety. It's okay for a dog to have social anxiety. We all have social anxiety too. Just like when we were going back to kindergarten, there were some kids in the schoolyard that just
Mm.
made us uncomfortable, and there were other kids in the schoolyard that we clicked with. I think a huge part of it is dogs exhibit body language signs towards each other that are really subtle, that can be hard for us to pick up on. And I wouldn't be surprised if your dog seems to inconsistently be reacting towards only certain dogs, because perhaps those dogs, there's something about them that they're exhibiting in their body language that's making your dog uncomfortable.
Okay, yeah. Um, my dog barks at the slightest noise in the hallway. How can I condition her to know those noises aren't a real threat?
Yeah, that's a tough one
Mm,
because if you wanted to truly do desensitization and counter conditioning, you could get a recording of the noise and expose them only at a volume where they're not going to bark and give them treats. But that's assuming you're creating a sterile environment, meaning you can control that those noises aren't ever going to be made outside your door beyond a certain volume. And that's just not realistic. So you can certainly still try that protocol, but I'd also recommend noise buffers in the home, white noise machine, insulating foam on the door frames and the windows to really blunt out the sound. You could do Through a Dog's Ears playlist on YouTube, or classical music, which is really calming.
okay, great. Is having one cat okay? Do they get lonely?
That's a good question. It depends on the cat. Um, it's hard to say without knowing the cat, but one of the more unfortunate common things I see, and I say this that my patient population is biased because I'm only going to really see the bad things. But unfortunately, people mean very well, and they're concerned that their cat's lonely or their dog's lonely. So then they get a second one. And now you're left with two issues instead of one: a presumably lonely cat or dog, and another cat or dog that they actually have a problem with. So I think there are some cats that are totally fine without others. If you wanted to try, you could certainly do something temporary, so you weren't bound to it, like fostering. I would recommend, though, not pairing an older kitty with a kitten or an older dog with a puppy, because those young ones don't fully understand adult body language and they test their boundaries. So
Okay, great. Is there anything, if you have a female cat, is it better to get a female cat or better
I
get a male cat?
so I'm surprised they didn't come by, but, you see in the photos, I have one girl and one boy. I did do that on purpose. It's in the literature, even in dogs, that sometimes female dogs might fight with each other more, male dogs might fight with each other more, female cats might fight with each other more, male cats might fight with each other more. A lot of it is anecdotal, but I personally have had a better experience with one male and one female.
Okay, and what about dogs? Is it
Same
similar?
exact thing.
Okay, okay, great. Um, I have a dog who barks whenever anyone comes to the house. He's excited and happy for company, not aggressive at all. He just wants to say hello. Should I train him not to bark?
That reminds me of my little puppy in the earlier part of the lecture. Um, Not necessarily. If it's not causing him a quality of life issue and he truly is just happy and excited, that's awesome. Certainly, if the dog was fearful and trembling and frantic, then for the dog's sake, I would try to desensitize them to guests coming into the home and making positive associations. But if your little guy is very happy, I would embrace it.
Great. Let's see. My dog tears up paper. We had someone say this about cats too. When I leave the house. Other than bitter apple, how do I cure him of this bad habit?
Well, one thing I'd wonder, is, do you have a webcam on to watch your dog when they're alone? Because sometimes destructive behavior could be a sign of separation anxiety. It may not, but it would be, I'd be curious, is your dog pacing or panting and barking? Same with your kitty, because it could be a sign of a bigger issue. Sometimes they're also just bored. So I would make sure you leave plenty of safe treats and toys to keep them occupied.
Okay, great. How do I stop urine marking? My oldest cat has suddenly started. He was my first cat, and at 2, we brought in 2 kittens, and recently, this past November, we brought in 2 more kittens. All 5 cats have been strays, which is great, from my backyard. But I guess, how do I stop the urine marking? Yeah, is
Yeah,
the question.
it sounds like there are obvious stressors in the environment. I will say it's not super common for a pet to suddenly display a brand new behavior out of social maturity. So I would definitely get a urinalysis on the kitty and check the cat out by the vet to make sure there's no medical concerns. Um, and then after that, if everything, hopefully comes back normal, um, and provided your cat is neutered, because neutering does stop urine spraying 90% of the time, the other 10%, oh well. You could get multiple litter boxes. Make sure that there's at least 2 inches of litter depth in them. You need to scoop them out daily. You need to completely dump out the litter and clean it new at minimum once a week. I find it's often not done enough. I will notice my female cat Dancer on day 8. If seriously, if I go day 8 and I haven't, because she poops right next to the litter box. So you need to just completely clean it out and then clean it with warm water and soap, because the phenols like Lysol are too aversive to cats. And if you find that he is spraying in a particular area, you should use an enzymatic cleaner, because he's releasing pheromones that keep attracting him to go to that area. We can't smell them, but he can. And he's doing it for territorial purposes, presumably too. So you can't just use like soap, water, or Lysol. You need to use an enzymatic cleaner. My little guy, little Prince, who's somewhere around here, also will occasionally mark outside of the box if I'm gone for too long. So I use the enzymatic cleaner anti-icky poo. I let it sit for 5 minutes. I wipe it away, and then I spray feel away pheromone, calming pheromone on it, so that there's a competing pheromone in that area so that he's less likely to keep going back.
Okay, great. Okay, this is an important one I want to get to. My dog eats poop. Is it okay to use a mild shock or vibration collar when he makes that attempt? Uh,
Good question. That's called coprophagia. Unfortunately, coprophagia is really one of the toughest things to train out of a dog, because it's extremely self-reinforcing. Some dogs, I don't know why some, not others, have it innately wired genetically that they need to eat poop so that predators don't come by. Also in the wild, wolves will eat poop if there's worms in them, so that like worms signify intestinal parasites and that the herd's not doing well. So this is a very innate thing that the dog probably developed, and ideally we would go into the brain and plunk out the neurons that are telling the dog to keep doing that, but that's not possible. So my best recommendation is management. If you see that he's about to go for it, just move him away, pick him up. On walks, keep his eyes on you with cues and treats so that he's more motivated to look at you and get a treat than he is to look around for poop. Then you could also basket muzzle train so that he doesn't get at it.
okay, but I think maybe we should just address no, don't use a shock collar, right?
I
That don't,
don't
yeah,
generally
yeah,
recommend it.
yeah. Okay. Let's see. My If my dog is anxious around another dog and I give her a treat in the presence of that dog, am I reinforcing her anxiety or conditioning her to associate the other dog with a treat?
Well,
Yeah.
remember, fear and anxiety interferes with the gene transcription necessary for learning, so you're not reinforcing anything.
Uh-huh.
If it's not desensitized, so your dog needs to be exposed to the other dog at a level where she's not over threshold. If she's over threshold, I think just give her a treat, to distract her, get her out of it, and move along the way. When you can't have the two dogs at a distance where they're both under thresholds, that's where you could start giving a treat to reward better behavior.
Okay, great. And then we have people asking how they could make an appointment with you or get in touch with you. If you go to our website, amcny.org/behavior, you'll find that information there. We did also have someone saying, why are there so few veterinary behaviorists?
I don't know. I wish I had an answer. I think the big part of it is like I always say, veterinary surgery, as an example, is a specialty that's been around since the 1800s. Veterinary behavior as a specialty has only been around since the 1980s. So I think just in time there will be more.
And to complete the residency, it takes a time, right? I mean, it's
Yeah.
the program. So
Yeah.
yes, yeah.
Everybody. Yeah.
But it seems like it is a growing field and very much. But anyway, we are so happy to have you at AMC. This is, wonderful. And thank you for joining us tonight. Your insights have been incredibly valuable. We will send this link out to everyone tomorrow, as I mentioned, along with, I think someone had a question what the cleaner is. I think you said icky poo, right? So
Oh, anti-icky poo. Yeah.
anti icky poo, sorry, yes. So we will send that as well. But thank you again, Dr. Spano. This was terrific. I really, really appreciate you being with us. Thank you, Kimberly Young, for helping to organize this and all of our events. And a very special thank you to all of you for joining us. It really means a lot, your interest in our programming, and we appreciate the time that you spend with us. And just a very special, on a personal note, just I want to say a very happy birthday to my mom, who's here and attends all of our webinars. So thank you for that. Okay, everyone, have a great night. And again, we'll send this out tomorrow. Thanks again. Bye-bye.
Thank you for joining.